Total knee replacement. Osteoarthritis is quite a common condition affecting 80% of us by around 60 years of age. The knee is the second most common joint affected by arthritis. Arthritis can be related to age, rheumatoid arthritis, and previous sporting activities or injuries. The knee joint is formed by your thigh bone or the femur, your shin bone or the tibia, and kneecap or the patella. When healthy, the knee joint lining is smooth and the surfaces glide on each other, making knee movements effortless and without pain. The kneecap stays in the middle and glides on the thigh bone. When the joint becomes arthritic, the lining surface becomes rough, and in end-stage arthritis, the smooth lining has degraded to a sandpaper-like surface, making knee movements stiff and restrictive, causing pain while walking and after activities. It is this roughened joint lining that causes pain. When knees become arthritic, the bone surfaces start to rub together, thereby causing pain. Arthritic knee pain can be quite debilitating. This pain can reduce walking distance, can disturb sleeping patterns, restrict sporting activities, leisure activities, gardening, and can confine patients to indoors. It can at times get in the way of work, and in all affect quality of life. Painkillers and anti-inflammatories help initially. Consult your GP when pain does not respond to pain management and when your quality of life is affected. Your doctor may recommend physiotherapy and activity modifications. Crutches, braces, and insoles may help in selected cases. It is beneficial to control your weight, eat healthy, and stay healthy. Your GP may inject a steroid into your knee which can provide good short-term pain relief. If your pain is not manageable with non-surgical treatment, you may be referred to a knee specialist. If you suffer with end-stage arthritis and when all non-surgical treatments fail to control your symptoms, your surgeon may recommend a knee replacement. Your surgeon will describe the procedure and discuss the risks and benefits involved. You should weigh the risks and benefits carefully. Discuss with your family and friends if required. After you understand the procedure, take your time to come to a decision. Only when you are mentally prepared should you proceed with knee replacement surgery. Read and understand the reading material provided, as well-informed patients are happy patients. You may need help and support from friends and family during the early post-operation recovery period. If you decide to proceed with the surgery, you will have a thorough preoperative general health assessment. Have your dental assessment at least 6 months prior to surgery. Discuss all things with your specialist, such as pre- or post-surgery holiday plans and your regular medications. Avoid cuts and bruises on your legs before surgery, as this may lead to the cancellation of your scheduled surgery. You will be admitted to hospital on the day of your surgery or the day before. During your knee replacement, the skin is cut in the middle of the knee. As this will help keep it supple. After your operation, You may need to walk with a frame or crutches for a few weeks. Physiotherapy and exercise are extremely important. You will need to take care of your knee's surgical wound and avoid getting it wet to prevent infection. If all has gone well, you will be happy with the knee replacement surgery and feel it was worth the effort. As in a majority of cases, it will give you back your quality of life.